Good evening, one and all, and welcome to the McHenry County Board of Health regular meeting for November 18, 2024. Begin the meeting by roll call vote, please. Roll call.
Mr. Markison?
Here.
Dr. Amsler?
Here.
Ms. Carmen? Here. Ms. Alta? Ms. Gaffney?
Here.
Ms. Morowski? Dr. McGuire? Here. Dr. Katz? Here. Ms. Ortiz? Here. Dr. Zurich?
Here.
Ms. Clark? Here. And Mr. Clark?
Here. Is anybody here for public comment tonight? Hearing and seeing none, we'll move on to item 3, minutes approval for the October 21st, 2024.
I make a motion to approve the October 21st, 2024 minutes.
I second it.
The motion has been made by Ms. Carmen, second by Ms. Clark. All those in favor say aye.
Aye.
Those opposed say nay. Ayes have it, motion passed. Next item is employee recognition. Tonight we are recognizing Brenda Gazella for 5 years of dedicated service and commitment to public health. Thank you, Brenda. Quite an accomplishment. She's not here tonight. Whose department?
She is in the nursing division.
Yes.
She is an administrative specialist, and she works primarily in our TV program as far as making appointments and checking people in. But she is one of those people that you can always count on to help with anything, and an individual that will step up even if she sees something that needs to be done just to get it done. So she is an extremely valuable employee, and we love her.
Very good. Item 5, department and division updates. Here to start.
Sure, I'll start and I will be brief. So on tonight's agenda, we have the bilingual pay resolution as well as the Crystal Lake renovation resolution. Both of those are going to go to the county board tomorrow. Tomorrow night is the big meeting where the county will, we hope, soon approve the budget. So stay tuned to that. I'll be there tomorrow. And that's really all I have. The comprehensive health protection resolution, which is also in your packet, that won't go until December. And then when we get there, we'll talk about that. So,
Any questions from the board? Comments? Thank you. Director Noel?
Thank you. I had told you earlier in the year that we had kind of piloted those virtual office hours with our food program. You know, we started out with about 175 attendees, and you know, we've gone through the year and we're really holding steady at about 40 to 60 a month. So it's really I think been a worthwhile thing, and it's been beneficial, I think, both for our staff and our restaurant operators. So I think it's going to be useful this next year as we transition into the new FDA retail food code. So it'll be an opportunity for us to do targeted training, and then we're looking at potential actually to do that in some of our other program areas too. And then I just wanted to say, as we're kind of getting down here to the end of the year, that we're working on some cross-divisional projects that are kind of exciting. Susan and Megan and I are working on one to update our activity reporting system to make it more real-time and more digital instead of so much manual entry. And then we're working on some cross-divisional education, similar to what we did last year with the foodborne illness outbreak education. So it'll be enhancement of our website, this time related to rabies investigations, tick and tick-borne diseases, and West Nile virus. So we're kind of excited about that coming into the new year. That's all I have.
Questions, comments? Thank you. Director Karras?
So our mobile clinic will be at MCC tomorrow. They have their wellness fair, so there's going to be representation inside the facility as well as in our mobile clinic. So we're excited about getting it out. We are seeing a marked increase in pertussis cases. I'm not sure if you saw that press release, primarily in school-age population. So we are watching that very closely. We got messaging out to providers as well as to the general public. COVID remains low. Influenza, we're starting to see an uptick. Nothing that's unusual for this time of year. So we're continually watching that. With our respiratory surveillance funding that we received, we are starting respiratory point of care testing on December 2nd, and we're going to be using the ER trailer that's parked in the parking lot so that people can just pull up, we come out, we test them, we give them the results, so that they don't have to get out of the car or come into the building. We are working with Nick to set up a way for people to go online and schedule that appointment for them to come into that testing. So that's going to be rolling out on December 2nd. We're also having our first long-term care facility respiratory roundtable, which will be at MCC tomorrow. Again, we're using this respiratory surveillance funding for long-term care facilities. And we have speakers coming from the state as well as our own internal speakers, nurses, and epidemiologists to talk about managing outbreaks in the facility and prevention of those respiratory illnesses in their facilities. One more thing, probably saw this on the media, we did have our first Mpox Clade 1 case here in the United States. So that is, we're also watching that very closely, offering the vaccine for that. It's in very low risk for our community, but it's something that we're watching very closely. That's all I had.
From the board? Thank you. Director Howell?
Yes, thank you. Just a couple things for you. You might remember in 2020, we introduced the potentially dangerous dog. That's when we felt as if there hadn't been a lot of issues with the dog, or the bite or the interactions hadn't been very severe. So we wanted to have some in between not deeming and having to go dangerous. We have our first dog who's at the 24-month mark. And would be coming off the list. So there is that opportunity, if a person has a dog that's been deemed potentially dangerous, that there's been no violations, no issues with the dog, and they can request to have the activity looked at and appealed. So we just had our first one. We are starting to look at our spring vaccination clinics for rabies, and we're talking about doing a couple off-site. So we'll look at our stats. I'm going to assume, though, that our stats are going to tell us that we need to have a clinic probably in Harvard and a clinic probably over by Johnsburg, Richmond area, somewhere in there. So we'll start thinking about that. I'll let you know when we know the dates. And then we did meet with Chameleon. We were supposed to meet with them a few weeks ago, but they just got to us last week about that image scanning. So helping us do the data entry of our registrations. Actually, it's vaccination registrations that they would be putting in. So basically, we discussed how that works. We have a program that works with Chameleon called Knowledge Rocket. That's how we get all of our microchips from Chameleon up to the different sites that need that information about who's registered for what microchip. It's also how we do all of our lost and found dogs. It pulls that, Knowledge Rocket pulls that information from Chameleon. So supposedly this program does the same thing, can pull the information from an Excel file and with Knowledge Rocket put it into Chameleon. There still has to be some data entry. There still has to be some validation. I just found out Friday that Cook County Animal Control is just getting their contract with them off the ground. So I'm going to be interested to see how theirs progresses and then what ours looks like compared to theirs. And then the only other thing is that we're still holding on to 16 animals from our criminal court case from July. We're hoping that we'll have some closure on that as far as our portion of it, as far as holding the animals, having them relinquished, maybe later this week. That's all I have to report.
Anything from the board?
I do have a question. When the animal gets released off of the 24-month period, are they still required to maintain the same protocols even though they've been released? Like, say, if they're required to wear a muzzle when they're out, do the owner understand that they still need to do that, or do they think they don't have to do
We
that?
make the recommendation, but because they've been removed from that list, they would not be required to do that. That's why we're very careful about which dogs we would name potentially. right? We're making sure the owner is doing training with the dog, depending on whatever whatever has made the dog behave that way. And then we're recommending that they continue to muzzle, but we couldn't require that at this point.
But do you send them something in writing?
Yes.
Okay. And then my next question is, I'm on the hearing committee. We haven't had any hearings of people objecting to the designations they've gotten for their animals this year.
That goes through the court process now.
So
So we
nothing
really
through the
haven't had
hearing
too many who have appealed,
Okay.
because they do have to go through the circuit clerk and it is expensive.
Okay. So that won't
We're
come to
also very careful.
that won't come to the hearing committee anymore. Okay. Thank you.
That's by state law.
Thank you. Director Marin?
Question for you, sir.
I'm sorry.
Sorry, can you remind me on the potentially dangerous dog, what other additional oversight mechanisms are in place for that 24 months?
They have to be up to date on their vaccination registration. We need to know where they're living, who the owner is. They have to be cared for by somebody over the age of 18. They must be leashed at all times, and they have to be muzzled. So really, the one thing that's not is that they have to be muzzled off the property, not on the property right now. And they don't have to be spay or neutered, where a dangerous dog would need to be spay or neutered.
And what is the follow-up to make sure those things are maintained? Are they required to check in with us, or if they just, is it a reactive thing, like they get, some other incident occurs in public and the dog's not muzzled, then that comes into play?
So there'd be two things. One is they get the designation, it tells them what they have to meet and by when, and so all those are sequenced out, so someone's checking in with that. And then once a year, we're also checking in, are they vaccinated and registered, because we don't want any of those dogs to go out of date. We want to be as close to the date as we can. And then as far as the muzzling or not, that would be part of the neighborhood.
Okay.
We do let law enforcement know animals that have been deemed potentially dangerous or vicious. So they are aware.
And in the instance, if they don't meet those requirements, what is the enforcement mechanism?
Potentially dangerous dog, we would probably move right into a dangerous dog designation, review it again and see if we need to do that right away. In a dangerous dog, we can impound the dog and determine what we need to do from there. We still would have to, they either would have to give us the dog to impound or we'd have to get a warrant. And there is some financial obligations to that. There's some fines that go ahead with some of those different things. If a dog's not muzzled and it's out in public, there's a $200 fine for that.
Are we looking still at potentially beefing up or in tightening some of the loophole, or not loopholes, but some areas where we could tighten up? Are we still looking at that ordinance changes potentially?
You were talking specifically, I believe, about the rabies observation portion of it.
Yes. In
And
addition to dog bites, yes.
Yes, we are tightening some of those up as far as the bites and the rabies observation and quarantines go. We just have to do what we can by
Sure.
law.
Okay, thank you.
One follow-up question. So if the dog bit another dog, which is not dangerous dog, it's the serious one, right? Dog on dog?
A dog on dog, any dog can be deemed dangerous, regardless of whether it's bit a person or not, or bit another dog. It all really goes on what transpired, how many violations we have in the past.
Okay.
There's a lot that goes into it.
I just, I have a friend that had a dog go through the system because their dog was killed by a husky, or had to be put to sleep because it was shredded. And if it goes off the 24-month period and the dog's not in a fenced yard and is not required to have a muzzle or be on a leash, I think, do you notify the people that?
We just sent our first one, so we haven't even sent the letter out yet.
Oh, okay.
So if you have some thoughts on that you want to share with me later, we can kind of talk about that and put some consideration into
Okay, thanks.
what we can do.
Thank you. Director Marin?
Thank you. Employee Appreciation Week kicked off today with apple cider and some apple trivia. We have a week of fun. Tomorrow will be the all-staff breakfast. We're going to be doing it separately because a third of the staff is going to be at the Mental Health Board for de-escalation training. This is the third training out of 4, so we'll have one Tuesday and Wednesday for all staff. So that'll be great. We have other things planned throughout the week for all staff and some really cool stuff. Melissa kind of talked about the ARPA funding for the Crystal Lake building. It is on, again, the county board meeting for the Stuckey contract. They were the lowest bidder. And once that is signed, sealed, and delivered, we will start pre-construction meetings. That will entail other meetings with staff, facilities, IT, on schedules for moving and getting everyone settled into other places so construction can begin. So we're looking forward to that. I have been reviewing with IT the HIPAA security rules, and we found out through a 3-day seminar that they are going to be updated in 2025, which led to a lot of new items being incorporated into the security rule, which also will affect the privacy rule. One of the items being AI. You might have bots in there getting information and grabbing pieces of data. They could turn around and start getting that data out to other people if the code reads so. So we need to make sure we're working very closely with IT and the entire department on how we do that, if we're integrating any systems, if we have MOUs or BAs, that we are sure that the third-party vendors are doing what they need to do to keep their security as well. So we're working with EMA, Megan Toop, ER, with Bridget Hoffman, and IT, and we're going to do a pre-meeting to schedule a cybersecurity tabletop. Thing is probably in, I'm going to say February or March, so we will have that exercise coming up, and we're very excited about it. Kind of see what the scenarios would be and how we will need to react. So it's very exciting, and that's all I have.
Anything from the board? Thank you. Director Eck.
Thank you. So just a couple quick updates. We partnered with 5 police departments to provide leave behind kits when they go on potential overdose calls. So a leave behind kit includes like Narcan, fentanyl test strips, gloves, masks, those kinds of things. Our MRC volunteers were chosen to be interviewed for a promotional recruitment video that's going to be released through statewide. So they chose us, which was great. And we're conducting a whole body approach class with the Northern Illinois Food Bank at Stone Soup and Marindale Food Pantry. And so those classes are healthy eating classes, but at the end of each class, each participant gets like different fruits and vegetables to take home. So we are, Woodman's is providing that for us for that class. And just the last thing I had is just a shout out to Bridget Hoffman, who Ann mentioned, is our ER preparedness coordinator, and she received her Illinois Professional Development Certificate through FEMA, and that certificate just allows us to better be prepared to partner with EMA in the case of emergencies. She had to complete 13 courses to receive that certificate, so glad that she...
Questions? How about a round of applause? Manager Dietz.
Just a couple things. So we're getting ready to close out the fiscal year. This is the end of this month is the end of fiscal year 24, and then we'll roll into 25. So we're reviewing POs, GPRs that need to move forward, that are going to be for items that maybe we don't receive in time, need to keep the money into next year. I've been working on a system with OnBase, trying to streamline our process for our recs and invoices. We have a lot of paper right now. We get invoices electronically, but then each division has paper recs. So this system will allow everything in one place so that everybody can see it at any time. So we're almost ready to roll it out. We're testing it right now. So hopefully within the next couple of weeks that can be rolled out, and hopefully they'll help everyone in the divisions also.
Questions? The budget that's going to be worked on tomorrow night. That went through preliminary review. How did we do? Has there been any significant questions of our items?
So hopefully everything passes.
All right. It's good to hear. Thank you. Dr. Tomaso? Sure.
So Susan mentioned there, pertussis outbreak, so just to touch on, review of kind of what pertussis is, or some of you don't know much about it. Pertussis is also known as a whooping cough, so it's a bacterial infection, preventable bacterial infection. The reason we're seeing more of it is people choosing not to vaccinate again. So it's also known as the whooping cough, can go on for weeks to months, has to be treated within the first 3 weeks. It's a very, very persistent cough, so if you see somebody with pertussis, they're coughing almost constantly. And it's called a whooping cough because they cough so much they can't get a breath, and then when they can't get a breath, they have to suck air and it makes a whooping noise like that. And then they'll cough so much that it activates the gag reflex, so they'll cough and they throw up. So coughing so much they throw up can be a sign of the whooping cough, although not all coughs that cause you to throw up is the whooping cough. So not everybody that coughs so much they throw up is pertussis. So, and then so the vaccine is always comes on another vaccine, pretty much always the Tdap, so tetanus, diphtheria, and pertussis. And anybody you know that's not up to date on your Tdap, then you should get updated. Even if you're up to date just on your tetanus, then you should get updated on your Tdap vaccine, especially if there's going to be a baby born in the household, grandkid, niece's nephew, wife having a baby, you should be updated on your Tdap. And we're also seeing an uptick, like ahead of the flu season, of mycoplasma pneumonia, which is the atypical pneumonia. It's a pretty common pneumonia. It's a community-acquired pneumonia. It tends to be less severe than other bacterial pneumonias, but it can be severe in people that are immunocompromised or that have other illnesses going on at the same time. It's actually treated with the same antibiotic typically as pertussis, so there's a risk of a shortage of that antibiotic, which is azithromycin or any of the macrolides like clarithromycin. So, encourage people not to rush in to try to get like their Z-Pack for their colds or that kind of thing, and encourage clinicians not to be giving that out because there's a risk of shortage of the typical antibiotics that we use for those. So, any questions about that?
When you're vaccinated,
yeah.
How long is that vaccine good for?
It should be 10 years for pertussis. One of the downfalls is that Medicare doesn't cover the pertussis part of it. They only so when you go in for a tetanus shot, we only give the tetanus part of it, the TD, the tetanus diphtheria. So, elderly people aren't getting the pertussis part of it, which, yeah.
I kind of felt like there was more such a combo vaccine lately.
Yeah.
Like whenever I update someone's tetanus for non-pertussis reasons,
right.
I give the Tdap.
Well, now they sort of like discontinued. This was like kind of right when I've been out of urgent care for a little bit. I mean, getting big, but like right when I was leaving, like they kind of discontinued the TD, so we were able to then give Tdaps for Medicare patients again. So I think we're back to being able to give Tdap, but
So is it routine to give this vaccine to adults? I can't think of. I mean, I'm not
yeah.
opposed to
I mean, if you're
vaccine.
there for your primary care,
You gotta go to a doctor, not a vet.
So
You gotta go to a doctor, not a vet.
Yeah.
I actually just got mine.
Yeah.
Yeah, Friday. They
Yeah.
asked me, like, it's been 10 years.
Yeah,
And
if
I
you're
asked
out
them
of
how
date,
often.
you go to your primary care routine, health.
my parents got it when I was going to deliver, and they made sure they were up to date because of the pertussis portion. So opportunities.
Good information. It's the first time I'm hearing stuff like this.
And for some reason, it's just not immunogenic by itself. It has to have another thing to go with it. You can't. There's no such thing as pertussis by itself.
Vaccine.
Correct. Correct.
Right.
And the risk of the whooping cough is more in children than it is in adults?
Tend to see it more in children, correct? Yes. So that might be part of why it's not much concern in the elderly, but.
But they can be carriers and transmit it too.
Right.
Did kids get that vaccine?
Oh, yeah, oh, yeah,
Yeah.
they get like 6 of them before the age of a year and a half or something, yeah.
I just checked on my daughters.
Yeah,
Yeah, I went back and counted, I was like,
it's the D tap before you turn 1, which is like, there's more.
yeah.
There.
Yeah, I was like, why are the letters backwards when I
Yeah,
read?
it's one of those things like we never learned about in medical school, like pertussis, diphtheria, tetanus, measles, mumps, rubella, like we never learned about these illnesses in medical school. I didn't really, because they didn't really exist.
We
And
heard,
now we had to learn about them.
or never see some of these things
Yeah.
either. Not only learn about it, we actually never see it in clinical practice, but we will.
Are these vaccines still required to attend school?
Mm-hmm, oh, yeah.
There are like certain exemptions you can apply for.
Yeah, but
That's what I was gonna say.
So like, does that mean that I got mine at Northwestern?
Mhm.
I don't think I was at Northwestern 10 years ago, or maybe I was, but do they have record of that?
if you're a healthcare worker or certain fields, then you would have to be immunized. So, like, I know I've been in healthcare since I was 19. I've always had to show I have like titer. You can also have your titers. So like if you can prove immunity and like certain things like hepatitis B, like you're immune for life. So if you can show your titers since I was 19 years old, then I'm good for life. I never have to get another hepatitis B shot. So it just depends. But I have to get a tetanus shot every year. So it just depends on what field you're in. If you're not in like healthcare or other fields, I don't know what other fields require annual vaccines, but.
Any questions, comments? Thank you. Anybody else to speak at this point? No. The next item on the agenda is our consent agenda. Does any board member want an item removed or items removed from the consent agenda? Seeing none, I'll recognize Dr. Amsler.
I move to accept the consent agenda.
I'll second.
Any discussion from the board? As this is a topic that involves money, let's do a roll call vote, please.
Dr. Amsler,
Yes.
Mr. Markison,
Yes.
Ms. Gaffney,
Yes.
Ms. Carmen,
Yes.
Dr. Katz,
Yes.
Dr. McGuire,
Yes.
Dr. Zurich,
Yes.
Ms. Clark,
Yes.
Ms. Ortiz,
Yes.
and Mr. Clark.
Yes. All in favor? Motion passes. Thank you. Next item is new and unfinished business, 7A bilingual pay resolution.
Yes, somehow, so it's on the agenda, I just asked Norm, apologies, somehow, like, we see it on the e-scribe side, but it does not appear to me. So this came out of Personnel Committee, I don't know if. Do you see it?
Yeah.
It's not on my end. So I think there's something like maybe a glitch. But for those who see it, great. I don't see it when I go to the online system, so I just want to make sure double check. So this is essentially to clean up, there were 2 previous resolutions. This is to appropriate the dollars, just formally go back. All those ARPA dollars have to get appropriated. So this is going to be for this year, for FY24, and then 25 and 26, because that all has to be done by December. So this is just to clean up and make it very clear what is the remaining amount of bilingual pay through 2026 that is going to go on ARPA. And then it is to go on the general fund after that.
It's on.
It is now.
Oh.
Well,
I'll recognize Mr. Markison.
I'll make a motion to approve the resolution authorizing an emergency appropriation of designated ARPA funds to the Department of Health's fiscal year 2024 budget for bilingual stipends.
Second.
As this went through the Personnel Committee, you care to comment?
Yeah, so again, we did discuss this. Part of the only part of the issue here was there was some kind of issue in finance or in terms of just like keeping the accounting straight. This was a more convenient, efficient way going forward for them to manage that. So we just wanted to make sure that we worked well with county in order to make this easy to manage. And then obviously, we've already talked about that the dollars have a time limit basically associated with them. So there's a timeliness component. And then we did opt to increase the amount that gets paid out, which you can see down there on the 1, 2, 3, 4, 5, fifth line down there, fifth paragraph down. Does anybody have any questions? Personnel, or pardon me, well, I think more than one committee probably discussed this, and then we're in approval, and we're recommending to the board to approve it.
Everybody good? As this is a monetary issue, first of all, motion's been made by Mr. Markison, seconded by Ms. Gaffney. And because it's monetary, we'll do a roll call, please.
Mr. Markison?
Yes.
Ms. Gaffney?
Yes.
Dr. McGuire?
Yes.
Dr. Katz? Yes. Dr. Ansler?
Yes.
Ms. Carmen?
Yes.
Dr. Zurich?
Yes.
Ms. Clark?
Yes.
Ms. Ortiz?
Yes.
And Mr. Clark.
Yes. All in favor, motion passes. Thank you. Next item is Crystal Lake renovation resolution.
And do you want to speak to it, or do you want me? This is essentially the money, again, appropriating the dollars to do the project. The project did come in higher, and that is all laid out in the backup documentation and will be paid for with ARPA dollars that the county has. So from ours and if there are specific questions about the project itself, oh, Dr. Amsler.
Is it our intention to relocate the entire health department to Crystal Lake?
No. So we're simply doing reconstruction on the building. It's going to get expanded, and we're going to change some of the design on the inside. So the staff that are there now, though, will have to be relocated, at least on the clinic side, temporarily while the construction is going on. We're working on the animal control side to keep as many people there as we can because the animals are staying put. But no, it is not like we're expanding the building. That would be a freestanding building for the whole health department staff.
This will be an off-site.
It's what's there now, it's just getting enhanced with a drive-through, reconfiguring lobby space and some of the offices and updating the building. I don't know, Ann, do you have anything to add?
That's pretty much it. Are there specific services that will be provided only there?
Well, animal control, is the only facility. We have IBCCP, pretty much works out of that office, and Wise Woman. But we do WIC and immunization clinics out of that site. And WIC, did I say WIC?
Chronic disease.
Chronic disease.
Did this appear before committee at all?
I'm sorry.
Was this in front of a committee at all? No.
It's been through public health. It's been through the county side.
Correct. Not on our side.
Correct.
Okay. Is a board member wish to be recognized on this funding resolution? You?
Make a motion to approve the Crystal Lake renovation resolution.
Second?
I'll second.
Any discussion from the board? Okay, motion has been made by Ms. Gaffney, seconded by Dr. Katz, Dr. McGuire, sorry. And because it involves money, again, roll call vote, please.
Ms. Gaffney?
Yes.
Dr. McGuire?
Yes.
Dr. Katz?
Yes.
Ms. Ortiz?
Yes.
Dr. Zurich?
Yes.
Ms. Clark?
Yes.
Ms. Carmen,
Yes.
Dr. Amsler,
Yes.
Mr. Markson,
Yes.
and Mr. Clark.
Yes. All in favor? Motion carries. Thank you. Next item is the CHPG funding resolution.
So that's our comprehensive health protection grant funding. So we already budgeted for most of this grant, but we didn't know how much additional dollars we were going to get. So this essentially adds to, into our budget, the dollars that we did not know we were going to get. The additional amount is $87,000. So that brings the total grant to $439,243. So that needs to get added to our budget.
Everybody understand it?
Make sense?
Like forgive me, we ended up getting more money in the grant than we anticipated, is that?
So annually, this is a recurring grant. So we budget every year.
We didn't know what we were gonna get.
We didn't know what, so
Okay.
we budget conservatively, then we got this additional amount.
Ruby, Merry Christmas. I'll make a motion to approve the resolution authorizing the emergency appropriation of $87,000 in additional comprehensive health protection grant funding to the McHenry County Department of Health's fiscal year 2025 budget.
I second.
Any discussion from the board?
This is money we have not already spent, correct?
Correct. It's for this fiscal, so now we're in state fiscal year 25, which started in July. We do the budgets, in the middle of the summer, so we budget for them, and then, we just recently got the actual awarded amount, which the $87,000 is not included in the amount that is currently in the budget for 2025. And since they're approving the budget tomorrow, this will go in December and get added to the fiscal year 25 budget, because it's not in there right now. Does that make sense?
Okay. A motion has been made by Mr. Markison to approve the CHPG funding resolution. It has been seconded by Ms. Ortiz. We will do another roll call, please.
Mr. Markson,
Yes.
Ms. Ortiz,
Yes.
Dr. Amsler,
Yes.
Ms. Gaffney,
Yes.
Ms. Carmen,
Yes.
Dr. Katz,
Yes.
Dr. Zurich,
Yes.
Dr. McGuire,
Yes.
Ms. Clark,
Yes.
Mr. Clark.
Yes. Motion passes. Next item is approval of the employee personnel policy handbook update. Who's going to? This one disappeared in front of the personnel committee, correct?
Yes.
I will have you speak on it,
We need
please.
to look at it again. We've looked at it a lot lately.
Let's give the 134 pages a quick skim.
Yeah, so there are updates that go on, as you all know. Some of them are housekeeping, some of them are a little more depth. There's 134 pages. It's gone through a lot of vetting. I think I've read every page, but there's a lot in there. We did look it over in personnel, I'm pretty sure, as one large component of it. I'm sure it's gone to other people. I apologize, nothing jumps out in my mind right now. Was there anything that you recall that?
Jan, do you want to cover it? I mean, a lot of it's legal.
A lot of it was legal, the updated laws that came into effect for and things like that. Other ones were title corrections, manager to director. And there were a couple of questions that we took back to the state's attorney on FMLA leave for if both parents work for the county, the mother gets 6 weeks off, and then the father gets 6 weeks off. But the mother also gets 6 weeks for the pregnancy and delivery, and then the 6 weeks for bonding time, and then the father gets 6 weeks for bonding time. That was one of the questions.
There was something else about confidentiality in regards to allegations and the way it would work, and we discussed.
Correct, because it was worded that we will do our best to keep everything confidential. However, if something goes to litigation and is then a public document, the confidentiality is harder to keep hold of because it's now a public record. So we confirm that as well with the state attorney's office, and otherwise it was just basic, syntax, just updates and, reworking sentences and any new laws that came out in the previous 2 years.
Are we requiring signature on receiving these?
Yes.
Okay. From each
And we do
employee?
them through Power DMS. We are going to talk to IT about uploading that so that when every employee reads it, they do an electronic signature so that way we know, and that way we can go back to it to show that it's ready and signed.
Perfect. So I just want to reassure everybody that despite the length of it, it's predominantly housekeeping and non-discretionary, requirements are law. And there were 2 questions. The committee was involved, had quick questions. I appreciate the state's attorney's office for assisting, answering questions for us. We did recommend the full board approve it. Any questions? Anybody find anything interesting?
There's a summary, so the summary of changes starts on page 78 in your packet.
So you're looking for a motion?
Yeah, I was just waiting to see. Everybody's good? Okay. What is this one titled? Just gonna go with- I'll make a motion to approve the employee personnel policy handbook update.
Second.
Any discussion from the board? Okay, motion has been made by Mr. Markison to approve employee personnel policy handbook update. It's been seconded by Ms. Gaffney. I think we can do a roll call or a voice vote on this. All those in favor say aye.
Aye.
Those opposed say nay. Ayes have it, motion passes. Thank you. Next item is merit pay memo.
Okay, so this is another one that came before personnel. And the bottom line, in McHenry County as a county, you may know, approved a merit pool for all employees, I believe are all non-exempt or.
So annually, the county board approves the merit pool and the performance guidelines. And then each year, we have brought it to the Board of Health to decide how they want to distribute that merit.
So 3.5%, and typically in years past, we have agreed to that 3.5%. Do you want to speak on the extra portion of it, that's the reclassification and the 1.75% and how that?
Okay, so that is also part of what the county board approves on an annual basis. They take 50% of the annual merit increase percentage, and they move the salary tables by that much. So I'll try not to complicate it.
This is why I asked
do
you.
have somebody in the room that could help me if I bungle it. But if you imagine like if somebody started in June and they were hired at the minimum of their grade, that grade is going to move, that table is going to move starting December 1 by the 1.75%. And that is also typical of what the county has done every year, and that's part of their grading and compensation system. That is recommended by Archer.
So if, the way I thought of it, or I'm not sure, and I'll say this out loud again, and I know we talked about this, and someone can correct me if I'm wrong, but it's not just that you as the employee would get 3.5%, it's that the other people in your grade would also, like you'd all move together half that distance, and then the other half you would get, you're gonna get 3.5% nonetheless, right?
You're gonna get 3.5%. Okay, there are some qualifiers though.
Depending on time.
Yeah, depending on when you were hired
Mm-hmm.
into the position. So that's all laid out in that document through the pay for performance guidelines. On the first page of that, which I think is page 214 in the packet. So they lay out for new hires. So if you were hired 12/1 of 2023 through February, you get 100%. March through May, 75%. June through September, you get 50%. And anybody hired after September 30th is not eligible for the 3.5% increase, but they would get the table move. Does that make sense?
It's kind of weird. So it's prorated, but if you just got hired, you would still get at least the half of it, the 1.75%, because the whole table is moving.
Makes sense.
Did I miss anything? Okay. We have a specialist in-house
Yeah,
today.
it took me like an hour to get it the first time I heard it, so. Any questions? Concerns? No? Okay. I'll make a motion to approve the merit pay memo.
Second.
Any questions from the board? Comments? Okay, a motion's been made by Mr. Markison to approve the merit pay memo and the merit increase. And it's been seconded by Dr. Amsler. Yes, roll call vote, please.
Mr. Markison?
Yes.
Dr. Amsler?
Yes.
Ms. Carmen?
Yes.
Ms. Gaffney?
Yes.
Dr. McGuire?
Yes.
Dr. Katz?
Yes.
Ms. Ortiz?
Yes.
Dr. Zurich?
Yes.
Ms. Clark?
Abstain.
Mr. Clark?
Yes. Motion passes.
Took me a second. It took me a second. I was like,
Yeah.
I got it. I put it all together.
I'm glad you recognize it. Next item is 7F, Employee Appreciation Guidelines and Anniversary Booklet. Is this an item that requires action, or is this information?
Well, I think it's more information. I don't think it requires Board of Health approval, but we wanted you to be aware of where we're at with developing the employee recognition guidelines and the initial pass at having gifts essentially for major anniversaries. That booklet is items that the committee, we have a employee recognition committee made up of employees, maybe that is redundant, who meet regularly and came up with these items based on feedback that they got from employees. It is not the end-all be-all. You know, the program will continue, they will continue to expand the recognition program. And do you have any?
Yes, in addition to the booklet, the employee committee is looking to do, anniversary pins, but then going a little beyond. And we had a big discussion regarding gift cards. And employees went out and talked to other employees. Because they're gift cards, we would have to tax them. And they have no problem with that. They would rather have the gift card than get something, a booklet or something else. So what we would just like to do is formally put that in front of, the board. We talked about it at the personnel committee, and everyone was very positive about saying yes, we need a gift card. So that was one of the main topics of the conversation. So really the guidelines are to let you know what the committee does, what they're looking at, both formal and informal appreciation and recognition, and how we can get there. So the gift card conversation was very important, and I think everyone was in agreement that that is something we want to move forward with as well.
And then that would be, I guess I changed what I said earlier. We would need board to formally make that recommendation and have it in the minutes for the purposes of the auditor and being able to move forward with gift cards.
That's right. It was working on it. Yeah. Okay. Again, personnel looked at it. We talked with them. We talked about gift cards. We talked about the taxes. We talked about at the bottom line is if the employees, if this is what they want, then and if we want to assist them in this, then it just makes all the sense in the world. So, personnel committee recommends that this board, approve that and put that down on paper. Does anybody have any questions? I the motion in terms of this, just to agree with the employee committee on dispensing awards? Not really
I think
sure.
specifically what we're looking for was around the gift card language, because that's not currently,
I see.
when the board approved recognition and approved a budget for that or made a recommendation for the budget that was then brought to the county to add to our budget. Gift cards weren't part of that, weren't contemplated. We have other things like logo wear, and, you know, the kinds of gifts that are reflected like in the booklet, you know, whether it's a service award that somebody would select or, you know, the little radios or little watches, you know, depending on what year anniversary they are. But gift cards are not currently in here, and I think without the support of the board and an approval to move forward or a motion that you support the use of gift cards as an additional item that could be a choice for employees.
Okay.
Does that make sense? Do you have it, Dan, anything?
I think it's.
No, that's good.
I'd like to make a motion to approve the use of gift cards as deemed appropriate by the Employee Appreciation Committee.
Second.
Questions or comments from the board? The expenditures for these employee appreciation items, including the gift cards, we've already budgeted for that.
Correct.
That is, so this is no new expenditure.
No,
This
we're
is
not asking for additional
this is-
budget.
authorizing use of that money to pay for this program.
Out of that budget, being able to choose a gift card as an additional item that somebody could select to be recognized.
Very good. Okay, motion's been made by Mr. Murkison to approve the Employee Appreciation Guidelines and Anniversary Booklet, including the use of gift cards. It has been seconded by Dr. Amsler. Roll call vote, please.
Mr. Markison?
Yes.
Dr. Amsler?
Yes.
Ms. Clark?
Yes.
Dr. Zurich?
Yes.
Ms. Ortiz?
Yes.
Dr. McGuire?
Yes.
Dr. Katz?
Yes.
Ms. Gaffney?
Yes.
Ms. Carmen?
Yes.
And Mr. Clark?
Yes. Motion passes. Next item, slate of officers. In the packet is a document with the slate of officers. Each one of the officers that currently sits is eligible to continue on for another year or two. This slate that's in front of you is for the fiscal year 24-25. And anybody have any comments or concerns? I need a motion for somebody to nominate the slate of officers.
I'll make a motion to nominate the slate of officers.
I'll second.
Questions, comments? Oh. Motion has been made by Dr. McGuire, second by Ms. Ortiz, to approve the slate of officers as presented. We can do a voice vote on this. All those in favor say aye.
Aye.
All opposed say nay. Ayes have it, motion passes. Congratulations to all the officers. Any board issues? I hope he's got anything to talk about.
So many things.
We'll see how long that lasts. Okay, information, item 9 on the agenda, information communications. You've got some thank you, some happily ever after and strategic preparedness response documents. I do enjoy seeing those, especially the pictures. So keep up the good work. Any comments on those? There is a need to go into an executive session tonight to discuss Chapter 5, so 120 125/2, item C 29, internal audit, and chapter 5, 122C1, personnel matters, I have an employment contract negotiations.
Mr. President, I'll make
And to review executive session minutes from November 20th. Go ahead.
So moved. I'll make a motion to review executive session minutes as well as discuss an internal audit as well as discuss personnel matters and an employment contract.
I'll second.
Okay, motion's been made by Mr. Markison, second by Dr. Amsler to enter executive session. All those in favor say aye.
Aye.
Opposed say nay. Ayes have it.